Hello, everyone. Thank you for joining me for this 20-minute just boost of some education and information on adolescent sexual health screening using ACT. So before we begin, I just have a few housekeeping items. Please view the presentation in full screen mode. Some fonts or images that I'm going to be sharing, especially towards the end of this 20 minutes, might appear really small, especially the slides with some example data reports. So full screen allows you to see everything that we're sharing and allows you to kind of step away so you're not trying to look at your email and do multiple things at the same time. Just take a break, walk through this for 20 minutes. We'll be using the chat and the Q&A box. So at the end of the webinar, I will be looking to see if there's any questions that have been added to the Q&A. So open that box up as we go along, type in any questions you have, and then at the end, I'll come back to that. So I just want to set the stage related to youth sexual health. As you can see here, when we were reviewing some RAPS data, and that's data of 50,000 youth, complete surveys annually across the US, you can see those dramatic jumps in sexual activity, particularly between the ages of 14 and 15, and then that 15 and 16 age group. So in that 2-year time period, there's over a 300% increase in sexual activity. And a lot of times, a lot of professionals kind of wait and don't talk to youth about sex at those earlier ages. But as you can see, those would be the most important or impactful times that you could really make a difference, provide education, information, and using data like using RAPS or data that you might have within your technology-based systems can really help you understand your population. So if you weren't aware, pulling that data about sexual activity, you would see those significant jumps and be able to really underscore the need to provide some services, provide some interventions for youth that you're seeing, whether it's in your program or as a healthcare provider in those age groups. So it gives you kind of that backbone to really improve the services and care that you're providing. We know in current practice in sexual health care, a third of those teens that receive well care did not have any discussion of sexual health at all. So you think about those jumps in ages, but to not even talk about it at any age. And then looking at chlamydia screening for that population at highest risk, those females, 15 to 21, in the preceding 12 months, 60% of them had not been offered or received any type of chlamydia screening. So we know we have a lot of work to do. So how can we get that done? There's a lot of variability in screening and doing comprehensive sexual health histories. That experience and skill level of the individual provider or professional that might be working with youth, whether that is in primary care, maybe as a community health worker, maybe as a behavioral health provider. We interact with youth all the time, and sexual health is one of the biggest pieces that we want to make sure that we're addressing. Really knowing what those clinical guidelines are, that chlamydia screening is recommended for all females in a certain age group, knowing when those change and what that looks like, having some communication strategies that you can use that really help you connect with youth and guide them towards safer decisions, overcoming some of the subconscious bias we have as human beings and as professionals, and just our personal comfort level. A lot of adults are not comfortable talking about sex with teens. So I'm going to do a poll to start out with. I want to know, how effective are you in identifying sexual health risks and guiding youth towards safer behaviors? So I'm going to launch the poll, and if you can, on a scale of 1 to 10, 1 being like not at all effective, 10 being like extremely effective, where do you feel you are in kind of identifying those risks, doing that comprehensive sexual health history, and then guiding youth towards those safer behaviors? I'll give another minute and then I will share those results. So it looks like the majority of us are 45% are at about a 7. So that's really great. We also have some of us that feel even more effective than that, and some a little bit less. So I'm hoping that the information that I share can help you, no matter where you are in this, kind of think about how you're using data, how you're collecting information, and then how much time that's taking you as a professional as part of your practice. So part of how we can move forward in effectiveness, maybe going from that 7 to an 8. So if you think, if whatever number you are, if you were a 4, or if you were a 3, or if you were on the higher end, like a 7, what would it take to get you 2 numbers higher? So if I'm a 4, what will it take to get me to a 6? And technology can help in that piece. It's one way that we can get there. So I'm going to share some information on the ACT Sexual Health. It's a virtual health educator technology. Takes youth about 7 minutes to complete. It's based in the stage of change theory as well as motivational interviewing theory. So it was developed based in that. So that's kind of where it grows from. It provides a comprehensive sexual health history, provides some of that motivational interviewing piece. That's why it's called like a virtual health educator, guiding youth towards creating a safer sex action plan. That then you can talk with them about how you can help them achieve that plan, what services or referrals might they need. That's the in-person piece or the discussion piece. And then youth have the option of opting in to receive text messages that are based on how they responded to questions within the assessment itself, to really help remind them and keep them engaged in that safer sex action plan that they create at the end. So I'm going to show you a little bit of those pieces. First, I'm going to talk about what's included in what we call a comprehensive sexual health history. So the CDC has identified behaviors that put teens at increased risk for STI and unplanned pregnancy. So it uncovers those behaviors. You can see those on the left-hand side. Having sex before the age of 13, having 4 or more partners, not using a condom in the last time they had sex, and then contraception and alcohol use. So those pieces put teens at highest risk according to CDC data. And then we looked at the literature on what are other risk factors that contribute to unsafe sexual decision making. So some of those are included in this list here in the sexual health history, that substance use, not just alcohol, but other substances, depression and low self-esteem, being homeless, not being successful in school or academically, sexting, having a history of abuse, and dating violence. So if you're doing a comprehensive sexual health history, you want to make sure to include those risk factors as well. And Title X a few years ago kind of changed some of their screening requirements to include a lot of what's in that second piece or that second column as well. So like I mentioned earlier, the ACT really supports professionals, incorporates that motivational interviewing foundation to standardize sexual health care for the youth that you see. So every youth is asked questions, and that comprehensive sexual health history is gathered and then documented within the system. So it saves you time of asking the questions and then doing the documentation. It's consistent with current national screening guidelines and counseling recommendations. It provides that comprehensive documentation, like I mentioned, to really reduce that face-to-face time and make it more effective by focusing in on, the next steps after having that plan is how are you going to achieve that plan? That's the most important piece. So it provides that kind of initial screening and understanding of what that teen needs, and then you kind of come in and provide that next step of getting that birth control, getting condoms, talking to their partner, lots of different things, which if you're in the sexual health field, you have an idea of what might be in that safer sex action plan. So we did a pilot originally using the ACT Sexual Health in primary care practices. So youth that were coming in for services identified as having had sex, being sexually active, they completed the act. And these are some of the initial results that we received in the pilot. So as part of being on track with motivational interviewing, youth are asked if they want to receive additional health education as they go through the module, and 86% agreed to that. And that really helps them be more open to the information that's on the screen. So if they're not agreeing to it, they're not receiving it. But when they are agreeing to it, then they are more engaged in the information you're sharing. Just over half opted into receiving those follow-up text messages, and 88% created a safer sex action plan that included a goal, because we know not all youth are ready to commit to a goal. So we were surprised using the technology how many youth actually had a goal as part of their safer sex action plan. And I'll show you what that looks like, kind of the look and feel when they complete the assessment and see that plan. And then qualitatively, you've said they preferred to use technology. They felt more comfortable disclosing to technology and then having that conversation with their healthcare provider, as this was in primary care, and that they were more honest using technology. So the system really provides this personalized user experience. And what that includes is the look and feel of the system was really embedded in the idea of digital empathy. And ACT takes that digital empathy approach, which means that what we looked at were the core principles like concern and caring that was expressed through computer-mediated communication. So how can you use technology to really provide that feel that you get when you're working with youth one-on-one? That's what digital empathy does. So it really helps youth feel more comfortable answering sensitive questions, allows them to be more honest when they're answering questions, so that as a professional, I can understand their needs and provide those resources and services that they need. In addition to a digital empathy approach with the technology, it was designed to engage them. As you'll see, they see one question at a time versus a screening tool where they have lots of different questions they're answering. They can get fatigued very easily. As you know, youth interact with technology that's very quick. So when you provide a long list of questions, sometimes they don't read them fully and can answer them incorrectly just because they're not looking at them fully. And technology really allows us to include some other unique features like an audio option, multilingual options to help reduce those literacy barriers that come up sometimes. You can send the screening remotely to their cell phone or to their email. And as I mentioned, the technology leads them or guides them towards creating a safer sex action plan that populates for them when they complete the assessment. That's very specific to how they answered questions as they went through the screening piece of the tool. So it pulls their answers in to that plan. So this is the look and feel for youth when they complete the ACT. As you can see, the feedback that we received when we were working with youth on the design is that they wanted only one question to appear at a time, and they had lots of ideas on the font, the color schemes. They also requested to have images related to the content that would be included with each of the questions for engagement. And then as you see here, a speaker button appears with each of the questions that allows them to listen to the text on each page. And what we heard from youth was that it's not always about the reading level or literacy, it's about engagement. So they're used to kind of listening. A lot of the social media and TikToks and things have those songs and voices and things like that. So some youth just want to use the audio for engagement. And then youth will receive feedback and messaging as they go through the screening tool. So they don't just answer questions and then see something at the end. They see messages and information throughout that were developed based on the principles of motivational interviewing. So they include reflections, affirmations, some summaries of the responses to questions that they had previously submitted. And it really helps with feeling like it's a two-way interaction versus a one-way just completion of a survey screening tool. And then this is an example of a safer sex action plan that was developed individually for each youth that complete the module or the technology within ACT. It's also based on motivational interviewing and supports their continued engagement in their action plan and helps boost their motivation. So you can see if they have a goal that will appear first. If they don't, they'll see the next 3 sections on what would motivate you if they don't have a goal, what would help keep you on track, or what do you need? What are your steps? And then what do you feel like the challenges are? What's going to get in the way? And then there's some messaging around each of those to help support that motivation and that continuation either of the goal or to create a goal in the future. And that's what you can use as a professional when you're going through the results with that teen. So as part of the professional interface, the system can be used in 2 different ways to review that tool by logging in, reviewing it online, 2 clicks, or logging in and printing it. So you might print it, you might have a support staff print it for you. You can see here, what you see at the top are risk tallies. So how many high risk behaviors, those CDC identified risks, how many moderate, and then how many protective factors does that youth have? And then what you'll see populating at the top of the report in sections are each of those action plan items. So the goal, the motivations, the steps that they need, the challenges. And then underneath that, you'll see the comprehensive sexual health history. So I've kind of collapsed those, but just giving you an idea of the different sections that are included. And then below that will be all the flagged questions. And then you'll have a notes section that you can use, an open text box, if you want to track some of the conversations that you're having with youth. So in addition to individual reports, it's really important to understand your youth population and what some of their sexual health risks are by reviewing your data. And I kind of showed some of that in the beginning of this boost session, those sexual activity by age. So with this full analytics suite, data can be reviewed with just the click of a button and used for your needs assessment, maybe some grant reporting, program planning, just improving your practice environment. The reports have been designed to really quickly answer the questions that you see here. What are the greatest risks, sexual health risks? Who is it that's at risk? Digging into subpopulations, and then risk over time. So are you making a difference in some of those questions? Maybe you're looking at increased condom use or use of birth control or decreasing some risks that impact sexual health, like depression or being in a coercive relationship. You can use a report to pull that information. So one of the most popular reports answers that question, what are the greatest risks in my population? And when we're looking at the ACT, those are sexual health risks. So you can see each of the ACT questions, and the percent of your population that answered that question positively will be the colored bars, and then all of the question responses will show up there as well. So if you can see positive risk and the percentage that did not have that as a risk. And then on every report, you'll see that there's filters. So you can filter by demographic categories, race, gender, age. You can also filter by question to really dig into a subpopulation, and I'll show you that on the next screen. So the subpopulation reports really allow you to drill down the data without needing a statistician, without needing someone on your team that's skilled in data analysis. This is an example of filtering risk by one of the survey questions. So I pulled out the question of whether have you had sex with 4 or more partners? And that question will appear at the top, as you see there, as 100%, because we're pulling in just those youth that answered that they were positive for that risk. And then all of the other questions within the survey will only have that subpopulation of youth. So you can see if they're at higher risk for any of the other questions and behaviors and risk factors that are included in the survey. So it allows you to pull a smaller population and then see risks just for that population. And when you click on one of those bars in any of the reports, what will populate is a list of who is at risk. So it allows you to see your clients or your patients that answered positively to any of the questions when you click on the bar. For case management, potentially, maybe a CQI project, you can target those clients or patients for further interventions. Maybe you're doing some group education. So the reports or the analytics suite was really meant to provide you with information that you could act on as you're seeing patients or youth are in your programs, as an administrator, and then sometimes as like a state level or a big project level administrator, you're able to look at those reports and provide them as part of your reporting back to grants, your needs assessment, and or to make decisions about care delivery. ACT is being used in primary care practices, family planning programs, or clinics, and in the community. We have case studies. You can find them at the link that you see here. And then this is a quote from one of the community health workers that is using RAS within her program. So that is our 20-minute boost. I can check in and see if there are any questions. Please take this time, these last few minutes, to type something in if you have questions. If you want more information, you can contact us at the email that you see here. Also, if you go to possibilitiesforchange.org, you can click on the ACT page and see a lot more information, kind of see that look and feel again that I shared within the boost. So I don't see any questions at this point. So hopefully you got a little more information just in general around adolescent sexual health risks and some of the ways that technology can help you be more effective and increase that quality of care that you're providing related to youth sexual health. So thank you again for joining me, and have a wonderful rest of your day.